Hi, my name is Janelle, and this video is going to be about the integumentary system and how a physician or healthcare provider would assess the skin. Upon arrival of the patient, the information that the patient should give is geared around the history of the patient, whether they've had an ongoing skin disorder or disease like eczema or psoriasis, hives, any pigment color changes to any moles, excessive dryness and moisture, any pruritus, so that is itching, excessive bruising. Sometimes patients will come in and they have multiple bruises throughout the body, any rash or any lesions. When assessing a child, the only differences that would need to be assessed is any birthmarks, any acne for the older child, easy bleeding or easy bruising, and sometimes changes in the hair and nails can also be good information. On the physical assessment, the healthcare provider may want to ask the patient what they do to take care of their skin. Like, do they daily put moisturizer on the skin? Do they, their hygiene, do they bathe with hot, cold waters? You also want the older adult to know that sometimes they can get irritation to the skin, which is called dermatitis, and this would be for sometimes for cosmetics, creams, or ointments that are used on the skin. And older adults tend to have a delayed inflammation response, so that's important for them to know. The next part would be inspection and palpation. You want to inspect the patient on the way in and just look at his skin and see if it's consistent with the genetic background. You would want to assess color change. So I'm going to talk about the color changes that you may see. Pallor, which is white, and this is the red and pink tones in the blood are lost. You can see it in the mucous membranes, the lips, the nails, palpebral conjunctiva, that's inside the eye. Anemia, you'll be, if the patient is exhibiting anemia, that's where you'll see the pallor is in the palpebral conjunctiva. You can also see this in shock or atrial insufficiency. Pallor can be caused by acute high stress states. That would be a response of the SNS, and it causes vasoconstriction. You can also see pallor in cold, extreme coldness, smoking, and edema. In dark-skinned people, of course, you're not going to see the pallor as predominantly. In dark-skinned people, the brown-skinned people, it'll turn yellowish color of brown, and in black people, they will turn more ashen or gray looking. The next color would be of the skin may be erythema, a redness. This is caused by excessive blood in the dilated superficial capillaries. You can have this erythema from fever, from local inflammation, and the local inflammation will also palpate warm or hot depending on how severe it is. Emotional reactions can cause erythema. Also, blushing, which will be on the cheeks, the neck, or the upper chest. Polycythemia, which is also from that'll cause a redness, and venous hemostasis, carbon monoxide poisoning, the skin will look red. In a dark-skinned person, you may not be able to see these changes or discrepancies readily, so make sure you palpate them. Palpate for warmth, any taut or tight pulled surfaces on the skin. Other changes that may not be palpated would be from decreased oxygenation, of course, would be a change in level of consciousness, a respiratory distress. So that might give you another sign. A cyanosis, which is a bluish mottled color, is it of the skin, and it comes from decreased perfusion. Sometimes you'll see this in shock or heart failure, chronic bronchitis because the patient is coughing so much they can't get enough air in, congenital heart diseases. This can also be a non-specific sign. Anemic people have hypoxemia without looking blue because they don't have enough hemoglobin in the blood. People with polycythemia, they will always look ruddy blue all the time. That's because they cannot fully oxygenate all the red blood cells. There's just all these increased amounts of red blood cells, and they can't get enough oxygen into it. Jaundice is another color of skin. Of course, this is not like a infant's jaundice. This is a cause of bilirubin in the blood, an increase of bilirubin in the blood. Let's see, it can be caused by hepatitis, cirrhosis, sickle cell, and transfusion reactions. You can also see this inside the sclera and in the soft palate and the hard palate in the mouth. You don't want to confuse the sclera jaundice with normal yellow subconjunctival fatty deposits located in outer sclera of dark-skinned people. So when you're assessing the eye, sometimes the dark-skinned people will have these little fatty deposits in the eye, so you don't want to confuse that. Let's see, some other non-specific issues that may give you more information would be light or clay colored stools, dark golden urine, and the nurse, this is a mnemonic that the nurse could remember all of this when assessing the skin, moles, nevi, or birthmarks. The mnemonic is A for asymmetry, B for border irregularity, C for color variation, and E for elevation and enlargement. If you have a patient in the office and they present with any of these issues, like rapidly changing color of moles and nevi and birthmarks, or newly pigmented, itching, bleeding, or burning to the skin, this could be signs and symptoms of malignant melanoma, and you should get them an immediate referral to a dermatologist. Let's see. I had a patient who has basal cell carcinoma. I think it's really interesting, and it's like the most common form of skin cancer. It's slow but inexorable. That's a difficult word. It doesn't invade any blood or lymph vessels, so it doesn't really metastasize, but it can spread in the surrounding area. It starts off with skin colored papule, and then it gets pearly borders and a red center. This is from undifferentiated basal or germinative cells. This is thought to be caused by UV radiation, but sometimes other factors can be arsenic, from groundwater wells. Let's see. As it gets worse, if it goes untreated, that is, the lesion grows and becomes ulcerated, develops crusting, and becomes firm to the touch. My patient has one that exhibits like a cauliflower on top of it, and it is very odorous. So it's very hard, so it would become firm to the touch. And sometimes this will invade surrounding tissues and can destroy a nose or an eyelid or an ear. I did download some pictures, but I'm not sure if you could see them. I'll show you the one that most resembles a starting of a basal cell carcinoma right here. So you'll see how it has the pearly edges in the center is kind of red. And this is one picture that will that's showing you the basal cell carcinoma that has spread to the surrounding areas and which is consuming the whole side of the face. So thank you for your time, and I hope this video is educational.